To discuss, we're joined by the Director of Affordable Medicines at the Department of Health, that's Khadija Jamaloodien. Thank you for being with us, Ms. Jamaloodien. Sad day for government and the country.
Good evening and thank you for having me. Yes, it is sad.
Can you hear me, Ms. Jamaloodien?
I can hear you. Yes, thank you.
Okay, so you've confirmed it's sad. I mean, at one stage, the criticism you faced was about a lack of vaccines in the country. Did you ever envisage a time when we'd have so many vaccines and just simply not enough people who want them?
So about last year, this time, the joke was the kind of problems we want to have is that we have too much vaccines. And sadly, today, we do have too much vaccines. And if I can just place it a little bit into context about on how we arrived at this situation. So we had contracts for vaccines and received it in country. So specifically for the Pfizer vaccine, it does have a short shelf life. So from the time of manufacture to the time it expires, it's about 9 months. And although we had staggered the deliveries that we received in country to make sure that those expiry dates were extended well into 2022, the demand for the vaccines did not keep pace with what we had on supply. So initially we had a supply constrained environment where we had to ration the use of the vaccine. So you recall in the early stages, we said we would reserve it for the elderly, we would use it in certain age groups. And then as the supply increased, we opened it up for more age groups to the children. We're giving boosters now. We're prioritizing immunocompromised individuals for additional doses. But unfortunately, the demand is not at the pace at which we would like it to be. So we do have 92,000 vaccines, which will reach the end of the manufacturer's shelf life tomorrow. Yeah. And unfortunately, that is something that, despite our best efforts, has occurred.
How many vaccines have we imported or manufactured, because we are making some Johnson & Johnson here, to put this figure of 92,000 into context?
Mm-hmm. Okay, so for the Pfizer vaccine, we've received 39 million doses. So it's 39,272,220 doses of Pfizer vaccine. We had bought about 32 million doses. And of the Johnson & Johnson vaccine, we received currently, in terms of the contract that we have, 20 million doses. Those doses, most of those doses were manufactured in South Africa. And the doses that have not been distributed to our facilities as yet are sitting in our central warehouses. So the J&J vaccine has a longer shelf life. They've come with a 2-year manufacturer's shelf life. So they will be expiring in 2023. But with Pfizer, unfortunately, some doses will be expiring tomorrow. But just to put it into context, 92,000 out of with a denominator of 39 million, it's less than 0.25%. So it's 0.24% of all Pfizer doses that have been received.
It is small, like you say, as a fraction, but reportedly nearly 900,000 are set to expire in May, another 845,000 in June, and that's taking us up, and then more than 4.8 million reportedly will expire in July. So that sounds like a bit of a ticking time bomb when it comes to July and the vaccines that will expire.
Indeed, that is again the manufacturer's shelf life. Please be aware that between now and May, June and July, there will still be orders that will be coming through and vaccines that will be distributed to facilities for administration. So that's basically a reflection of the stock on hand. That's the stock that we have currently at central warehouses. But as time goes by and the demand for the vaccine continues, that volume will decrease. We are keeping an eye on it to make sure that orders are coming through. And as you know, the department has embarked on a number of demand generation activities to make sure that the demand for the vaccines are maintained at a level where, we get suitable coverage, but also our vaccines are also used appropriately.
Ms. Jamaloodien, what's happening? Is this entirely due to vaccine hesitancy?
Well, I wouldn't say it's entirely due to vaccine hesitancy. I think there are a number of issues, a number of socioeconomic issues. It has to do with access. So, for example, people who do not have close proximity to facilities where vaccines are being administered, So you have to look at strategies on taking vaccines to the people. People are generally tied up in their work, so it's not vaccine hesitancy. If we make it easier for them to access the vaccines, people will be taking them. There is a large proportion of vaccine hesitancy, and in that respect, a lot of education needs to take place, and the education needs to be targeted for specific age groups. So, for example, the older generation wouldn't respond to social media messages, but they would probably respond to other incentives, such as, for example, as we had done with the grocery vouchers, for example. And then younger children, younger age groups, educating them about the vaccines, what it does, how it works, etc., and just creating a bigger understanding, a better understanding on how vaccines work and what the value of the vaccines are.
And does the Department of Health take some blame for the fact that people aren't being educated enough? And I know vaccine hesitancy is not unique to South Africa, but government really hasn't been able to get people on board with these jabs that the evidence is overwhelming across the globe that they save lives.
Yeah, so I think, education is a continuing activity. So it's not an event, it's a process. And we just need to maintain that momentum and try and intensify our efforts to get people to understand how vaccines work, make them more eager to receive vaccines. So there's a lot of work that goes into making sure that people understand, people are willing to take the vaccines. And it does mean that we have to do more in terms of education and demand generation.
All right. Well, thank you for your time tonight. So 92,000, just a fraction of what we've actually imported or made, but there are huge amounts, 4.5 million set to expire in July. That was the Director of Affordable Medicines at the Department of Health, Khadija Jamaloodien.